Ever wondered how a tiny organism, invisible to the naked eye, can bring entire communities to a standstill, affect millions of lives, and even reshape our world? Whether it's the common cold, the flu, or more complex illnesses like malaria or tuberculosis, infectious diseases are a silent yet powerful force. But what exactly makes these diseases so dangerous? How do they spread? And more importantly, what can we do to protect ourselves and our loved ones? In today's video, we'll explore the fascinating world of infectious diseases. You'll learn about the science behind these illnesses, what triggers them, how they impact your body, and why some spread like wildfire while others remain contained. But we won't stop there. We'll delve into real-world examples from diseases you're familiar with to those you may have never heard of, shedding light on what you need to know to stay safe. But here's the kicker. Do you really know which diseases are the most dangerous and why? Could you identify them before they become a threat to your health or your community? Are you fully aware of how simple daily actions, like washing your hands, could save your life? You might be thinking, I've heard of these diseases before, but what else do I need to know? Well, in the next few minutes, we're going to answer questions you didn't even know you had. For instance, how does the flu evolve each year? Why are some diseases airborne while others require direct contact? And more importantly, can modern medicine keep up with these evolving threats? By the end of this video, you'll have a comprehensive understanding of how infectious diseases work, how they differ from non-infectious diseases, and what actionable steps you can take today to minimize your risk. I promise, whether you're looking to protect yourself, your family, or just become better informed, you're in the right place. So stay tuned, because this is not just about learning, it's about empowering yourself with the knowledge that could literally change your life. Let's dive into the world of infectious diseases, where knowledge truly is power. Let's start by asking you a simple question: what comes to mind when you hear the term infectious diseases? Maybe it's the flu season that hits hard every year, or perhaps the global panic that surrounded COVID-19. But did you know there are thousands of infectious diseases, ranging from mild nuisances to life-threatening conditions? While some, like the common cold, are harmless, others, such as tuberculosis or Ebola, can cause widespread devastation. So what exactly is an infectious disease? It's any illness caused by harmful microorganisms, bacteria, viruses, fungi, or parasites that invade your body. Once inside, they can multiply, attack healthy cells, and disrupt your body's normal functions. But here's the interesting part: why do some diseases spread like wildfire while others remain contained? How infectious diseases spread, what you should know. Take a moment and think about the last time you had a cold or the flu. Did you catch it from someone coughing near you? Or maybe it was from touching a door handle. Infectious diseases spread in a variety of ways through direct contact, like touching or kissing, airborne droplets, or even contaminated surfaces. But here's the tricky part: some diseases are more sneaky than others. Let's take influenza as an example. The flu spreads through tiny droplets released when an infected person coughs or sneezes. But have you ever wondered why the flu is worse during winter? It's because the virus thrives in cold, dry air, which allows those droplets to hang in the air longer. On the other hand, diseases like HIV spread through direct contact with blood or other bodily fluids, making them more difficult to transmit but equally dangerous. Can you think of a time when you or someone you know unknowingly spread an infection? It's easy for even the smallest habits, like touching your face, to make you a carrier. The science behind infectious diseases. Now, you may be asking, what makes these tiny organisms so powerful? It all comes down to their ability to replicate rapidly and adapt to their surroundings. Bacteria, for instance, can multiply at an astonishing rate, with some doubling in number every 20 minutes. Viruses like the flu or COVID-19 are even more cunning. They hijack your body's own cells, turning them into virus factories. This brings up another critical question: why do some diseases evolve so quickly? Viruses in particular mutate rapidly, making it hard for your immune system and even modern medicine to keep up. You've probably heard about new strains of the flu appearing each year. That's because the virus evolves, changing just enough to bypass your body's defenses, which is why a new flu shot is needed annually. Have you ever experienced getting sick, recovering, and then falling ill again with what felt like the same disease? That's the challenge of mutation. What makes infectious diseases different from non-infectious ones? At this point, you may be wondering, how do infectious diseases differ from non-infectious diseases? While infectious diseases are caused by external pathogens like bacteria or viruses, non-infectious diseases result from internal factors, genetic conditions, lifestyle choices, or environmental influences. Think of diseases like diabetes, heart disease, or cancer. These are not caused by a germ you catch from someone else, but rather by long-term health conditions and risk factors. Infectious diseases, on the other hand, can be spread from person to person, making them a public health challenge. Which type of disease do you think is harder to control, one you can spread or one that develops internally? Both present unique challenges, But infectious diseases have the added complexity of rapid transmission, which is why understanding their spread is so crucial. Common and rare infectious diseases. Now, let's get into the diseases themselves. You might be familiar with some common infectious diseases like the flu, chickenpox, or even food poisoning. But have you ever heard of diseases like dengue fever, chikungunya, or Zika virus? These diseases are rare in certain parts of the world but can cause devastating outbreaks in regions where they are endemic. Then there are diseases like tuberculosis and malaria, which continue to affect millions of people globally, especially in areas with limited access to healthcare. Can you think of a time when you heard of an outbreak in the news and wondered, why is this disease spreading so fast there? Geography, climate, and public health infrastructure all play a role. Emerging infectious diseases, the hidden threats. But what about the diseases we haven't even seen yet? Emerging infectious diseases are a growing concern. These are illnesses that are new to humans, or existing diseases that are rapidly spreading into new areas. SARS, MERS, and more recently, COVID-19 are prime examples of how quickly a new infectious disease can wreak havoc. The question is, are we prepared for the next one? Preventing the spread, what can you do? Let's make this practical. What can you do to protect yourself from these invisible invaders? One of the simplest yet most effective ways to prevent the spread of infectious diseases is proper hand washing. It sounds basic, but you'd be surprised how many people skip this step. Have you ever wondered how many times you touch your face in a day? Each time you do, you increase your chances of catching something. Vaccines are another critical tool in preventing infectious diseases. By building immunity without the need to get sick, vaccines help your body recognize and fight off harmful pathogens before they can cause serious harm. When was the last time you got a flu shot or checked if your vaccinations are up to date? It could be time to protect yourself. But here's a tough question: can modern medicine really keep up with these evolving diseases? With the rise of antibiotic-resistant bacteria and new viral strains, it's becoming harder for healthcare providers to stay ahead. That's why there's a global push for new vaccines, treatments, and research into emerging diseases. So we've covered a lot today, from understanding what infectious diseases are, to how they spread and the reasons some are more dangerous than others. We've explored the difference between infectious and non-infectious diseases, taken a closer look at both common and rare infections, and even discussed how emerging diseases pose a hidden threat. More importantly, we've learned that prevention is within your reach, whether it's through simple practices like hand washing or life-saving vaccines. But here's the takeaway: infectious diseases are a reality we all face, no matter where we live or how healthy we are. The good news: knowledge is power. By staying informed, you can protect not only yourself but also your loved ones from these invisible invaders. Now, I want to hear from you. Have you ever experienced an infectious disease personally or in your community? What did you do to manage it? Drop a comment below, share your experience, and let's get the conversation started. If you found this video helpful, don't forget to hit that like button and subscribe to the channel for more insights on human health. And as I promised earlier, stay tuned for our next video, where I'll be sharing game-changing tips on preventing infectious diseases that you won't want to miss. Click the notification bell so you'll know the moment it drops. See you in the next one.